Hi, my name is Dave Ring with the Office of Statewide Health Planning and Development, Facilities Development Division, Supervisor Health Facilities Review for the North Region Plan Review. This video is for educational purposes to explain the history and proper usage of phased review and collaborative review and construction. Discussion of these integrated reviews within this video is broken up into the 12 parts at the right for easy searching and presented in 6 sessions. Session 1 includes introduction and history. Session 2, statute regulations. Session 3, Pin 50 definition of terms. Session 4, Pin 50 process parameters and goals and best practices. Session 5, sample review matrix, sample review log, and sample integrated review plan. And finally, session 6, designing your review examples and information, and change management process information. This is session 6, talks about designing your review and change management. So considerations in designing your review obviously starts with the size and cost of the project, the type of contract you expect to have, considering IPD level 1, 2, 3, the time needed and available to complete design and review process. It should look at the reverse phase schedule and consider value engineering. It should consider the different review options which have the tools available, as I've described, different review options that could help design your plan review for the project. So again, designing your review, you want to consider, as we discussed in a previous session, the requirements for phased plan review and the requirements for collaborative review. If you have a large project and you need to break it into many increments and you'd like to phase it, the review, up to 16 max, then collaborative review may be the way to go. Whereas if it's a smaller project, 2 to 3 increments, and 8 submittals will suffice, then maybe phased review is the way to go. And considering that the collaboration level in phased review is less than the collaboration level in collaborative review, and what I mean by that is not only the IPD collaboration level, but the collaboration between the office and the design team. Keep in mind that the collaborative review, you get plan exchange meetings and collaborative workshops, and phased review, the collaboration consists of plan exchange meetings. You want to consider the reverse phase schedule and look at that. That kind of gives you an idea if where you see occupancy needs to be and where project scope and design finalized is, may help determine what kind of review you need and how you need to break this down to get this project accomplished in the time needed. And again, utilizing the tools such as maybe a make-ready project or a preliminary design, which can both be submitted early on and get feedback. Actually, make-ready projects can get the project started early on prior to submittal of the entire big project. So these are all things to consider and tools to use to design your plan review process. Basically, review options consist really of 2 main review options. You can do a pre-submittal meeting and a standard review that is not phased. If you do a pre-submittal meeting, a standard review that is not phased, you can add a preliminary review and get some feedback. So if you have a smaller project that really maybe doesn't warrant phased or collaborative review, you could do a standard review, include a preliminary review in it, and get feedback, and then submit your 100% CD submittals. You could add increments to help break the project up, and as a phased or as a standard not phased review, you could actually do a collaborative review that's not phased. Benefits of the collaborative workshops during review and the collaboration of ACDs through construction. I think I already talked about adding a make-ready project to help get the project started early, break out some part of it that would get the project, is a smaller review, quick turnaround time, but yet gets the project started and ready for the main project. So that's one option, not phased. The other option is a pre-submittal meeting with a phased review. Now, a phased review, again, you could do a preliminary review early on, up to a year in advance of the main submittal, to get feedback and help with the design of the project. You again could add increments. You could do a phased collaborative review, which again gives you the benefits of the collaborative workshops as opposed to just a phased review with just plan exchange meetings. And again, you could incorporate a make-ready project to help get the project started early on and prepare some smaller portions of it so that they're complete and making ready for the big project. So those are the two items I would say to start with when you're designing your plan review process. Remember, a collaborative plan review process that can be performed prior to 100% implementation documents. Basically, you can do a phased collaborative or a non-phased collaborative. And keeping in mind when you design this, keep all the participants in mind while you're designing this. That is the owner, his schedule, the contract type. Consider the office, whether you qualify, and consider our resources and time to do these reviews. The design team, the time needed to design it, and the confidence level to move forward. If they have a big project and they're doing parts, they may want feedback on certain segments before they continue to complete all the 100% CDs or implementation documents. So phased review may be appropriate. Is the contractor on board? Can we get some value engineering done? Are the increments appropriate for the most efficient construction of the project? And others, you may even want to check with the users who are going to be using the project to get their input. The toolbox available to design your plan review process includes pre-submittal meeting, the preliminary review, over-the-counter review, phased review, collaborative review, phased collaborative review, a project with construction phases that we talked about in the earlier sessions that is different than the phases, again, in phased review, which are the design phases, an incremental project, deferred approvals, segments, make-ready projects, alternate method of compliance, protection, and program flex, the geotech and geohazards report, TIOs, testing, inspection, observation. We even have some conditional permits, which would allow demolition and excavation, And keep in mind the turnaround time guidelines for the plan review, for the office to complete their plan review. In designing your review, the design team should have a meeting with the owner and construction manager to discuss project tools and schedule. For example, desired occupancy date, required construction start date in order to meet that occupancy, the geohazards report to make sure that's done on time to start the plan review process, when does steel order need to be done, and make sure the plan review is at a point where the steel won't be changing due to comments, excavation of site when that needs to be done in order to get the foundation poured on time, and so on and so forth. All these things are things that should be considered when designing your review. What are the critical issues you would like reviewed, and at what point in the design? When will they be 100% complete and not subject to change? All these things will help design your review. Again, this just shows the matrix is aligned with our Acela program that shows the different phases and the allowable segments that can be submitted. So the goal, I'm going to talk now about change management a bit, and the goal obviously is to minimize changes, minimize ACDs, because changes take time, they cost money, they're very inefficient. It reduces construction time. So in order to minimize ACDs, we want to utilize as much as possible non-material alter. These are changes that don't materially alter the project, and this is specified in our code. Plan for appropriate process, and sometimes larger ACDs of similar content equal less ACDs. I know a lot of design teams want to send in small ACDs because it's quick turnaround time, which in some cases is appropriate, but in other cases, when there's information of similar content, it's sometimes more efficient to submit a larger ACD so that the whole thing can get reviewed at once rather than submit 8 small ACDs. That is, by the way, a very inefficient way for the office to deal with these. The other goal is to create the most efficient process. So ACDs don't always start at the field. It's important that the change management team is aware of the available venues to process change orders through the office, or ACDs. Should understand the resources. Some venues only can take small ACDs, whereas sending them to the office, we take larger ACDs. Know the process for the venues, know the criteria, how to schedule the OTCs or the review, and then how to monitor them. Again, we used to say that ACDs start in the field. We need to change that culture. The main reason is on large projects, if all ACDs start in the field staff, number one, don't have the time to review all the ACDs, and oftentimes by the time they give notice that they need to send that ACD to the office, sometimes a week or two has gone by. So it's not the most efficient way to handle these amended construction documents. This is just an example of some data that there's approximately 2 ACDs per million. If you take a $1 billion project, that's 2,000 ACDs. takes 4 years to do that project. That's 42 ACDs per month. If 50% of them go to the field, that's 21 ACDs per month to the field. The field sometimes can accommodate that, and sometimes they can't. So it's good for the change management team to send the ACDs to the appropriate venue. It's important to know what materially alter is. This is from the 2013 CAC 7153. As applied to construction projects or approved construction documents, means any change, alteration, or modification as determined by the office that alters the scope of a project, causes the project to be in non-compliance with the California Building Standards Code, or causes an unreasonable risk to the health and safety of patients, staff, or the public. This is just an example of how sometimes change management can be addressed in the integrated review plan and give a little more clear guidelines on what will be considered non-material. This will require field acceptance. Typically, the regional compliance officer will have to review this in the IRP if it's proposed to put this in the IRP. It has been put in some projects, and it helps to clarify sometimes. However, the code does clarify what is material alter and non-material alter. This is some diagrams that some large projects have used in one way or another. And basically, it lists the different venues available to review ACDs, and it shows the start of the ACD. To start with, can we do an office review? And it works its way around finally to the field. And lastly, you'll notice to critical path. The reason is too many times the designers want to take their ACD and shoot it right here. And if everything is critical path, nothing is critical path. So it's more efficient to have a well-versed change management team that knows the venues and has a process and knows approximately where this ACD should end up in this ACD venue chart. Again, this is basically showing the 4 different types or reasons why ACDs come about. The owner requested change, construction not built per approved plans, construction is per approved plans that may not comply with code, and information needed because approved plans are incomplete. And this gives some guidance on how to resolve these issues and when an ACD is actually required. Change management, as I discussed before, is a critical path, CPR, critical path, expedited review. Some criteria that the field uses in order to be a critical path. The code says the fundamental reason to qualify as CPR is to avoid undue delay. Well, any ACD could really fall into this category. So we, as the office, have to apply some criteria. And what we've done in the past is we've asked the question, what is the impact of the normal review time? Can work be done elsewhere? This is important. Inform OSHPD of the true date needed. Sending everything in and saying, hey, we need it yesterday, doesn't help us schedule resources to expedite it. If we know the true date, we may possibly be able to get resources on it to get it out in the time that you actually need it. Is urgency due to a recurring lack of planning? We may have to look at the process to see why there's so many critical path items coming up. And there should not be many CPRs on one project, as this is a sign of other issues that may need addressing. Again, if everything is critical path, nothing is. This is just a sample of a project that utilized the flow charts I showed previously. They put them in their own format here. You can use this and review it on your own. Again, this shows the different venues available at that time. Some of these venues are not available at this time with all that's going on, but this just gives you a sample of how this was incorporated into the integrated review plan. This is another flow chart for non-material alter, how to determine it, and the process for their change management team to follow. And that concludes the last session. So if you have any questions, for more information, you can contact Building Standards Unit at regsunit@oshpod.ca.gov. Thank you.